Okay. So now I'm going to start with the cranial nerves. I'm going to assess the cranial nerves first, then I move on. Okay. So cranial nerve 1, which is the olfactory nerve for smell. So you're going to tell me what this smells like, okay? Okay, what did you smell? Vanilla. Okay, yeah, that's a vanilla extract. You right. Okay, now cranial nerve number 2 is the snailing chart. You're going to close one eyes and read the numbers for me on the wall. What do you see? 1, 2, 3. Do the same for the other eyes. For the other eye, 1, 2, 3. Okay, so cranial nerve number 2 is intact. Now I'm going to assess cranial nerve number 3, 4, and 6, which is the eye movement and pallor and the people, how the people react. Okay, so you're going to keep your eye to the pen. Keep your eye on the pen. Move your eye when the pen, where the pen moves, not your head. Okay. Okay, now keep your eyes to the pen. Okay, keep looking at the pen. Don't move your eyes. Keep your eyes on the pen. Okay. Okay, so I'm going to check for the pupils to see if they constrict. Okay. Okay, the pupils are round, equal, react to light, and accommodate. That's good. So now I'm going to assess cranial nerve number 5, which is all over the face. You're going to tell me what you feel. This is the soft, and this is the sharp. Okay, close your eyes and tell me what you feel. Soft, sharp, soft, sharp. Okay, so cranial nerve number 5 is intact. Now I'm going to assess cranial nerve number 7, which is the facial nerve. Puff your cheek, close your eyes, smile. Okay, so cranial nerve number 7 is okay. Now we're going to assess cranial nerve number 8, which is the hearing test. Okay, tell me which side of the ear you hear something. Okay, so I'm going to whisper here. 1, 2, 3, 4, 5 on the right side. 1, 2, 3, 4, 5 on the left side. Okay, so the cranial nerve number 8 is intact. Now we're going to assess cranial nerve number 9, which is the swallowing. Okay, can you swallow for me, please? Okay, so that cranial nerve is good. And I'm going to assess cranial nerve number 10 and number 11, which is the neck movement, okay, and the spine. So can you move your neck left and right and the shoulder shrunk, back and forth? Shrunk your shoulder for me. Okay. Okay, I'm going to check the spine. The spine is okay, nice and straight. Okay, did not notice any deformity in the spine. Everything look nice and straight. Okay, so now I'm going to assess cranial nerve number 12, which is the tongue movement. Okay, move your tongue for me left and right. Okay, so the cranial nerve number 12 is intact. Okay, so now I'm going to start with, I'm going to assess your temporal artery, okay? I'm just going to feel your temporal artery. Okay, feel the temporal artery here. I'm going to palpate the sinuses. Lightly, palpate for sinuses. Okay, then now I'm going to assess the TMJ joint. Can you clench your teeth for me? Okay, so the TMJ joint is intact. So now I'm going to check the head. The head is nice and round. The head is nice and round. Symmetry. Okay, I'm going to palpate. I'm going to check the head for any lesion or any moles or any baldness. No lesion. The scalp is clear. No hair loss, even hair distribution on the head. The head is nice and round. Do you have any headache or dizziness? Do you feel dizzy or have any headache? No. Okay, so now I'm going to check for the eyes. Have you noticed any changes in your vision recently? No. Do you have any pain? No. Okay. So the eyebrows are present, the eyelashes are present, the sclera is white. Okay, you don't notice any drainage coming from the eyes look good. Then and they are in line as it's supposed to be. The eyes is right here as it's supposed to be in line with the ears. The eyes look good, the symmetry. Now I'm going to check the nose. The nose too is symmetry, nice and straight. The nose is symmetry, nice and straight. The external structure looks good. I'm going to check in the nose for any mucosa inside the nose. I'm going to check there. Check both sides. Okay, looks nice and clean and dry. So now I'm going to check for patency. Hold one nose and blow from the other one. Have you noticed any smell change, any change, like you having difficulty smelling something, any pain, any discomfort? No? Okay. Then I'm going to assess the ears. Check the external structure of the ears. They look nice and flat. The external ears of the structure of the ears look good. Okay, so I'm going to check in the ears to see if there's any. Do you notice any hearing problem, any problem with hearing? No? Okay. Check in the ears for any drainage, nothing. For the other side again, nothing. The ears look good. Do you have any pain in your ears? Do you have difficulty hearing, or you find out that you've been losing some words recently? No. Have you been losing any balance? You feel okay? Okay. So the ears is good. Any changes, and it's symmetry. Then I'm going to check the mouth. The lips are nice and pink as it's supposed to be. All the teeth are present. The tongue is moist and pink, not beefy red. The uvula and the palate all looks good and nice. Okay. So now I'm going to palpate for masses in the lymph. They're all intact. They're all okay. Okay, they're doing great. Okay. So now I'm going to move down to the chest. Do you have any chest pain? When was your last mammogram? Do you have any difficulty breathing, like you get tired easily? No? Okay. Do you cough? Yes. And what color is the sputum? What color is the sputum? It's clear white. Okay. Okay, that's good. So now I'm going to listen to your lungs, okay? Take a deep breath from it. Breathe in and out. Okay. That was the posterior view of the lung. So now I'm going to listen to the lateral view of the lung. And do the same for the other side too. Listen to the lateral view of the lungs. Okay. And I'm going to listen to the anterior view of the lungs. Can you sit up for me? Okay, the lung sounds clear, nice and clear. Okay. So now I'm gonna I didn't notice any pulsation. Do you have, like, the patient is breathing normal? Did not notice any labored breathing? The chest movement is okay. The chest is symmetry. I'm going to check the diameter of the chest wall, which is supposed to be 2, and the posterior view should be 2, and the lateral view should be half, on a ratio of 2:1. So the AP diameter of the chest wall is okay. Okay, so do you have any trouble breathing? No, you feel okay? Okay. So now I'm going to listen to the heart sound, okay? Do you have any pain? Okay. Do you have any pain in your chest? Okay, listen to the aortic valve. Okay. I'm going to listen to the aortic valve, pulmonic valve, Abs point, tricuspid valve, and the mitral valve. Then you listen to the apical pulse, which is just below the mitral valve, for a whole minute. Okay, so the heart sound is clear. Okay, so now I'm gonna check the radial pulse bilaterally. Check both radial pulse. Let me see if I can do it from this one. Yes, you check both radial pulse bilaterally. You check the brachial pulse, which is up here, bilaterally as well. Then you check the posterior tibial bilaterally. Then you check the dorsalis pedis bilaterally. Okay, then I'm gonna assess for any edema in the foot, mostly in the joints. That's where you notice edemas. Did not notice any edema. The skin color is nice and warm. Yeah, the skin color is okay, match the ethnicity. No edema. I'm gonna also check for skin toggle. Okay, the skin bounce right back. Excuse me. Okay, now I'm going to check for capillary refills in the nails, both. Okay, bounce right back. Check for capillary refills also here. Bounce back. Check for the toes for capillary refills. Okay, and the nail bed is nice. The nails are white and clear. No color change in the nails. They look good. They are not too broad. They are shaped nicely. Do you notice any tingling or numbness in your fingers or toes? Any parts? No. Okay. Do you have any pain? Okay, look, everything look okay. The skin is nice and moist and warm. The skin look good. So now I'm going to assess. I'm going to move to the... Okay, when was your last BM? Do you have any constipation or diarrhea? No. When was your last BM? Yesterday. Do you feel like you get up frequently in the night to use the bathroom? No. Do you have difficulty urinating, like any irritation or pain? No. Do you have blood in your urine? No. When was your last mammogram? Okay. Are you sexually active? Any vaginal discharge? Any pain? No. Okay. Okay, so now I'm going to auscultate the 4 quadrants, okay? Let me know if you feel any pain, okay? The right upper quadrant and the right lower quadrant, left upper quadrant and left lower quadrant, okay? The bowel sounds is normal. Okay, I'm going to palpate lightly for tenderness. No, the stomach is not distended. It's nice and flat, round. The umbilicus is in the middle. Okay, they did not notice any guarding, so the patient is doing right. Okay, yeah. Okay, so now I'm going to check for muscle strength in both upper and lower extremities. Okay, squeeze my hands. Pull, push. Okay, do the same for your foot. Can you push? Okay, pull, push down, push my hands down. Okay, the patients have equal strength in both upper and lower extremities. Okay, so that's all for my assessment, and thank you for giving me the chance to work with you. So the patient's mood was okay, was pleasant. The patient was conscious, alert and oriented, answers my question correctly, dress appropriate for the weather, did not notice any body odor. So the assessment went well. Okay, perform hand hygiene. I think I'm done.